Ever hear about the scary risk of serotonin syndrome when taking SSRIs? Confused about what it even is? Hi, it's Brain Bites with me, Dr. B. I'm Jess Beachkofsky, your friendly online psychiatrist, and this video is about serotonin syndrome with a case and everything. Let's dig in. One of the biggest risks of taking these types of medications, serotonin syndrome. This is a rare condition that comes from having too much serotonin in the body. If someone is taking multiple medications that block the serotonin transporters, the amount of serotonin will increase, sometimes to unsafe levels. Serotonin syndrome is potentially life-threatening, and a trip to the ER is recommended if someone takes an SSRI or other serotonergic medication and experiences these symptoms. Mental status changes like agitation, hallucinations, delirium, and coma. Autonomic instability, so tachycardia, increased heart rate, blood pressure that is variable, dizziness, diaphoresis or sweating, flushing, feeling very hot. Neuromuscular symptoms like tremor or rigidity, hyperreflexia or incoordination, even seizures. But also gastrointestinal symptoms, so nausea, vomiting, diarrhea. This is most likely to occur with the use of other serotonergic drugs. Here's a case example of someone with serotonin syndrome. Lauren, a 36-year-old female executive assistant, presented to the emergency room with symptoms of confusion, agitation, and muscle rigidity and stiffness. She'd been taking an SSRI, Prozac or fluoxetine, for depression, Imitrex or sumatriptan, which is for migraines, and oxycodone for chronic back pain. She was not consistent with taking her medications and often took higher doses to try to even things out when she felt really bad. Lauren's boyfriend called 911, and when she got to the ER, Lauren had altered mental status with confusion and agitation, a fever of 101.3 degrees Fahrenheit, excessive sweating, dilated pupils, muscle rigidity, especially in her legs, exaggerated reflexes, tremors, and involuntary muscle twitching, tachycardia with a heart rate of 101 beats per minute, and her blood pressure was fluctuating. The emergency room doctor suspected serotonin syndrome based on Lauren's medication history and presenting symptoms. These are the steps they took next. Immediately stopping all serotonergic medications, her Prozac, Imitrex, and oxycodone. IV fluids for hydration and to manage her temperature. She was given benzodiazepines, specifically Ativan or lorazepam, to control the agitation and muscle rigidity. She had continuous cardiac monitoring to watch her heart rate and blood pressure, and close observation of vital signs and neurological status. Lauren's condition began to improve within 24 hours of treatment. Her mental status cleared, muscle rigidity decreased, and vital signs stabilized back to normal. She was admitted to the hospital for further monitoring and supportive care. Over the next 48 to 72 hours, Lauren's symptoms gradually resolved. The medical team provided education on serotonin syndrome and the importance of medication compliance. Upon discharge, her medication regimen was adjusted to prevent future risk of serotonin syndrome with careful consideration of potential drug-drug interactions. Lauren followed up with her primary care doc and psychiatrist to reassess her medication regimen and develop a safer treatment plan for managing her depression, migraines, and chronic pain. Lauren's case highlights the importance of recognizing serotonin syndrome, which is potentially life-threatening and can occur when multiple serotonergic medications are combined. Prompt recognition and treatment can lead to a favorable outcome. I hope your brain is full of serotonin goodness, just not too much. Be sure to enjoy more tasty tidbits at brainbiteswithdrb.com. Enjoy.